Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Kim Downey. She's a physician advocate. And as always, she brings together wonderful guests. Today, we have Ellison, who is an emergency physician, Denise Wiseman, a healthcare executive. Today's Kevin MD article is, Do you think the needle is moving in healthcare? Everybody, welcome to the show.
Thank you, Kevin.
Thanks, Kevin. Thanks for the opportunity.
All
And
right.
Happy New
So
Year.
this is the first episode of 2025. It's an honor to spend it with all of you. So Kim, as always, you are such an advocate and passionate physician advocate. I see you all the time on LinkedIn. How did you bring Dawn and Denise together?
So we want to make a difference and we want things to change for doctors and patients. And that's you, Kevin, and me, and Dawn, and Denise, and a lot of other people. And you've asked on your podcast, do you think we're moving the needle? And I think that we've seen some small positive changes, though we have a long way to go. And you're asking that question inspired me to reach out to Dawn and Denise because they're both core members of the Medicine Forward and Healthcare Reinvention Collaborative teams. And we wrote an excellent article speaking to this, and I thought it would be important to introduce you to each other. And one of the things that they'll talk about is impact networks. And later in the conversation, I can share a specific example that's evolving that I'm particularly excited about.
Wonderful. And I think one of the things that I always see is that physicians want to make change in our healthcare system, but sometimes there's a lack of organization, right? If you talk to 100 physicians, they're going to have 100 different ways of what they think they should do. So now we're going to talk about two organizations who are making a difference, Medicine Forward and the Healthcare Reinvention Collaborative. So Dawn, talk to us about a little bit about yourself and then what Medicine Forward is.
Sure. So, skinny story for me is that as you said, I'm an emergency medicine physician, and I started coaching physicians as a side gig back in 2008. So, not only have I experienced the challenges myself as a physician, but also have been alongside many physicians over the years that have been struggling and these are people in all sorts of different specialties. So I had that perspective, and then I also had an opportunity to lead engagement and well-being for a healthcare organization. And, that's a different set of challenges because you're trying to move a whole organization rather than an individual who's trying to, work with things. So I'll tell you a little bit about Medicine Forward's focus, which is they focus on the physician-patient relationship. Long ago, medicine was physician focused, and then we kind of had a shift to patient centered. And while we're all there to take care of patients, the relationships, not only physician and patient relationships, but all the other relationships are important as well. And Medicine Forward has focused on that physician patient relationship and said, how can we together, patients and physicians, make it possible for that relationship to be sacred, to work what it should work. It's therapeutic relationship, right? And when you have a therapeutic relationship with a patient as a physician, it also feeds you. And so it's part of the answer for burnout.
So Dawn, as you know, I'm a primary care physician, and like many physicians, we see all the things that detract from that doctor-patient relationship, whether it's health insurers or pharmacy benefit managers, electronic medical records. So Dawn, how are the initiatives, or give some examples of some of Medicine Forward's initiatives that try to strengthen that physician-patient relationship?
Well, I can tell you about one big event that we did this past year, which was we did what's called an open space event in New York City, and it was adjacent to the Burnout Symposium. And we invited people to enter into conversations that they felt were meaningful to them around this idea of human connection in healthcare. So what can we do to restore and improve human connection in healthcare? And about 30 people or so joined that, annexed workshop the day before the burnout symposium, and they decided what about that was important to them. And so, those people are now thinking more deeply about those problems that they had an opportunity to connect with other people on. And that's just a start of something that may build into other things. But it was really cool to see how people just there was no pause after I said, okay, the space is open, step forward. What conversations do you want to have? People step forward, and it was so exciting.
So, Don, what kind of stories did you hear? I know there were so many. Just give us a flavor of what it was like to be there, and what are some things that you heard?
So one of the conversations that people had were about the medical marriage.
Hmm.
Another one was, how do we take care of the well-being of physicians in this financially austere state that we're in? I mean, that's a real problem. So some of these people were chief wellness officers, or somehow, in charge of, if you will, the well-being for the caretakers in their organization. And so any kind of issue that you can think of where that was an intersection, that's what they came up with and talked with. And some people had solutions, other people had more problems, and they were able to help each other out on some things. So
Today, we're also going to talk about another organization, the Healthcare Reinvention Collaborative. Denise, tell us a little bit about yourself and then talk about the collaborative.
Thank you, Kevin. So about myself, I've been in healthcare for decades now. I'm just going to say it that way anymore. I started as a registered dietitian. And on the front lines, I was a clinical dietitian. When I exited, I was in the executive team for the patient experience department at a large healthcare system out here in the Pacific Northwest. But during that interim, I've worked healthcare IT. I've worked with third parties outside of healthcare. I've worked across our nation. So I've seen a lot of different elements of our healthcare system. And when COVID gave me the opportunity, as I describe it, to redefine my career, I decided I needed to do something different. And so I was working as a solopreneur, trying to do something on my own. And what I quickly identified was there are thousands of us who are trying to reinvent this healthcare system from our perspectives, the lived experience we've had within the system or as a patient affected by the system. Through that, I recognized that we're in competition with each other. We're not collaborating and recognizing that a lot of the symptoms we're trying to solve have root causes. And if we could come together, we could actually solve a root cause that would lighten the efforts we're trying to do on the other side. And that's where Healthcare Reinvention Collaborative comes from. So we are seeking to identify, connect, support, and illuminate changemakers. And Kevin, you and Kim are changemakers. I like to call them ruckus makers. So anymore, I call myself a healthcare ruckus maker. But that is our focus, is how do we bring them together? And we're doing so around a model called Two Loops and using impact networks and a lot of the really in collaborative experiences that we can have that Dawn brings to our team, the open space technology and the other ways of connecting and level setting. Low hierarchy, we're all in this together. How do we unite and do this? You identified at the beginning, Kevin, the lack of organization that physicians or others who are trying to make change have, and that sense of, I'm alone, this is a heavy weight. We're trying to help lighten that through the connectedness. Now, that November 20th event that Dawn spoke of, HRC actually took that to the next step. So on December 16th, we invited all of those who joined us in November and others to come back together around the same topics that were raised in December, but we started to challenge them on what could we do and then what should we do so that we can move from conversation. There's a lot of conversation about the problems in healthcare, but start to move towards action. And that's the other piece that HRC is seeking to do through that support element, is how do we start to unite collaborators towards action?
So, Denise, tell me who you are bringing together. What are some examples of these groups that you are bringing together to affect change?
Yeah. So we started with people because there's a lot of individual ruckus makers out there. So we have physicians and nurses and, gosh, pharmacists and patients across the spectrum. We have healthcare marketers all across the spectrum. And each of those individuals, or most of those individuals, are solopreneurs or part of connected networks. So Kim Downey, Stand Up for Doctors. We have a number of the Medicine Forward individuals, Gabe and Todd and Jeff and others who are members of HRC, because the work that we're doing is so aligned and connected. We have individuals with organizations like Humanitera. Goodness, so many organizations. We have an Excel sheet with a list. And one of the things that we're seeking to do, Kevin, is make that visible. How do we see these people and how do we see the organizations they're associated with so that people can come to one spot, recognize these are trusted. There's this vetting process of who's in here. They are purpose-driven, not profit-focused. Profit, of course, is in there just to be able to be purpose focused, but their focus is purpose. So it's this trusted network that now people can come in and they can see a visualization of the different elements and filter it down to where their special interest is and find their people and start to collaborate.
Kim, you are well connected in the physician advocate community. Tell us the types of differences that you're seeing both Dawn and Denise make through their respective organizations. How are they moving the needle from your perspective?
Sure. Well, I'll share kind of a trail from the open space event. So again, so I'm on the traction team for Medicine Forward. We're with them, and I'm heavily involved in HRC as well. So when Dawn planned the open space, she was really our, what would you call it? Our
Ringleader.
leader in that, because she has a lot of
Champion.
experience. What?
Champion.
Yeah, our champion. Right, exactly. And we were more bumblebees, right? Floating around to support Dawn. And when we called that question at the open space event, restoring and nurturing the human connection in healthcare. And then the people who were there drove the questions, so they would go up. Old fashioned, it would have been with Post-it notes, but we had more the current technology, and they would raise a question. So then we got into groups, and whoever wanted to speak to that question got to talk about it. And we had a couple different sessions of that. And then, as Denise mentioned, following that on December 16th, we had another event and we brought up those questions. So there were some people that had been there in November and then some new people. And we got into breakout rooms. And for me, I was in the room about patient empathy and clinician well-being, because that day in November, a doctor raised his hand and he said, how can we foster empathy in patients for doctors? So obviously that's what I'm all about. So I was excited to facilitate that one. And as Denise said, we had 2 breakout sessions, and one was what could we do, and another was what should we do. And the people were so excited to talk about it, and I followed up with them. And now we're going to have another meeting to continue that. And as far as action, so I'm really excited about that. So we're actually going to start doing things. And one idea I have is I've been wanting to do something really big for Doctors Day, to let doctors know how they're supported. But I can't do all of this by myself. So to now have other people. So that's just one example. And then all the other breakout sessions, it could have been about AI, and different things. And then they can take those. And that's how we're really actually starting to make a difference, I think.
Mm-hmm.
Now, Dawn and Denise, I'm going to ask you the same questions about the respective organizations. And that's how do we translate, is what Kim alluded to, these meetings and getting people together, and how do we translate that to action? So, Dawn, can you give an example or a story about how Medicine Forward has taken action and moved the needle in redefining and strengthening that doctor-patient relationship? Tell us a story.
I'm not the best person for that, Kevin, because I'm the newest to Medicine Forward amongst the 3 of us, but I know that they have a program where they're doing some training with medical students and residents, I believe, and, making sure that those folks coming up through training are understanding the value of that relationship, that physician-patient relationship. I'm probably older than anybody on the call here, and And I remember the days when, the only thing that we used a CAT scan for was heads, right? And now we're scanning everything. We've got MRIs weren't around during my residency period. And I think our shift, our dependence on technology has become so much more than it was when I went through training. And you lose something when you depend on all that technology. You lose that observation, that history taking, that relationship building that you have with patients. Particularly, I'm kind of an odd emergency medicine doc in that I value the relationship I have with my patients, right? I know in primary medicine, you're much more attuned to that, but particularly in primary care where that relationship continues, right? In emergency medicine, the folks that I had more relationships with were not necessarily the ones that you wanted to continue those relationships, because those are the people that kept coming back to the ER for those reasons that we'd rather they, be able to change lifestyle, for example, and not need to come in so often. But relationships have always been important to me. And I think that by, Medicine Forward taking on this program with residents and medical students, that's an important way for us to change the way we do things, right? Because the way we do things is how we can impact solutions, right?
And Dawn, just to
little
follow up
example.
on that, in the emergency department, what are just some ways or tips that you can share to maintain and build those relationships, especially in such fleeting moments like we have in emergency department setting? What are some of the things that you do?
Well, it comes back to sitting down. I mean, we're pressured so much now for productivity in emergency medicine as well as primary care, and just that act of sitting down and bringing yourself to the level, right, of the patient is important. And it's funny because I think it's easier perhaps for me as a woman physician to establish that relationships because it's more of an expectation on the part of the patients. I once asked another redheaded doc who was kind of chiding me for my length of stay in the clinical rooms with the patients, how often patients asked him about his red hair, and he said never, and I said every day, multiple times a day, they comment about my red curly hair, so there's a different expectation, and I think it may be easier for me, but it's just being present with them and really meaning it when you ask them how they're doing, what brings you to the emergency department, right? And listening.
And Denise, tell us a story or example about how you translated some of those initiatives into action that moved the needle in our healthcare system.
Yeah, there's a couple things that have been going on. Pre-HRC, the original formation that I was working with, we were creating cohorts, so small sprint-like gatherings where groups would come around a topic that they were passionate about. And when we started, and from the point of start to the point of end, we created something. In 6 weeks, you might not be able to create a lot, but you're creating something. And so I lean often on James Clear's 1% better. If we are creating small differences every day, eventually we'll get to that tipping point. So we're doing the same thing with HRC. We're going to be starting in 2025, cohort-like, sprint-like projects where people can come together, such as what Kim is doing. We can have that structure where they can come together, they can ideate, realize that they do not have to solve the world. They can contribute that first 1%. Somebody else can grab that and go that next level. And together we will get to that tipping point. So that is exactly what we're doing. And through the connections we're making, we've already had 3 people tell us that the connections they've made through these types of engagements with us, with HRC, they are making a difference. And so what we often say is HRC is not going to reinvent healthcare. We're the convener, the conduit of those ruckus makers who will reinvent healthcare. So we're proud to be able to celebrate Kim and the gathering that she's having to continue that energy forward. That is exactly what HRC will be doing.
We're down to Kim Downey, Dawn Ellison, and Denise Wiseman. Today's Kevin MD article is, do you think the needle is moving in healthcare? Now I'm going to end with asking each of you just to share some take-home messages with the Kevin MD audience. Kim, why don't you go first?
Sure. So we all need to care, even if it's for self-preservation. Everyone has a story about themselves or others waiting for months to see a doctor, sometimes with deleterious consequences. And doctors are suffering in the current system. They're leaving and they're dying. And the reasons include deep systemic flaws, and you mentioned a few, Kevin, in the beginning, and also like loss of autonomy, monstrous administrative burdens, and moral injury, to name a few more. And if you want doctors to be there when you need them, for yourself, for your parents, for your children, and even if you're a doctor, because doctors need doctors too, we need action, and that's my word of the year. And just this week, I registered Stand Up for Doctors as a business. And my mission is to, thank you, is build connection and create advocacy for healthy doctors. So please reach out to Dawn, Denise, or myself, and we'll help you find your people.
Indeed.
Dawn, what are some of your take-home messages?
Sure. So frontline workers hold crucial insights for transforming healthcare, but they need spaces where their voices are truly heard. And, through various roles that I've had through my career, coaching, organizational work, and now, with Medicine Forward and HRC, I've seen how these collaborative approaches can reveal solutions that traditional hierarchies might miss. And so I invite people to join us, whether it's Medicine Forward or HRC, because we can do this better together than we can alone.
And Denise, we'll end with you. Your take-home messages to the Kevin MD audience.
My take-home message is that purpose that every change maker has is critically important. When you try to do it alone, you can feel isolated and ineffective. We can only do this together. So building that better future that we want for healthcare is possible through connection, trust, collaboration, building your network, and leaning in together.
Kim, Dawn, and Denise, thank you so much for sharing your perspective and insight, and thanks again for coming on the show.
Thank you
Thank you,
very
Kevin.
much, Kevin.